Heart disease and stroke, a closer look into Arkansas. So what exactly is heart disease, and what does it mean to have a stroke? To help explain, we have a clip that will show the ins and outs of cardiovascular disease.
Approximately 7 million people around the world die from heart attacks every year. And cardiovascular disease, which causes heart attacks and other problems like strokes, is the world's leading killer. So what causes a heart attack? Like all muscles, the heart needs oxygen, and during a heart attack, it can't get enough. Fatty deposits, or plaques, develop on the walls of our coronary arteries. Those are the vessels that supply oxygenated blood to the heart. These plaques grow as we age, sometimes getting chunky, hardened, or inflamed. Eventually, the plaques can turn into blockages. If one of the plaques ruptures or cracks, a blood clot will form around it in minutes, and a partially closed artery can become completely blocked. Blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes. This is a myocardial infarction, or heart attack. Things can rapidly deteriorate in the absence of treatment. The injured muscle may not be able to pump blood as well, and its rhythm might be thrown off. In the worst-case scenario, a heart attack can cause sudden death. And how do you know that someone is having a heart attack? The most common symptom is chest pain caused by the oxygen-deprived heart muscle. Patients describe it as crushing or vice-like. It can radiate to the left arm, jaw, back, or abdomen. But it's not always as sudden and dramatic as it is in the movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and the elderly. For them, weakness and tiredness may be the main signal. And surprisingly, in many people, especially those with diabetes, which affects the nerves that carry pain, a heart attack may be silent. If you think that someone might be having a heart attack, the most important thing is to respond quickly. If you have access to emergency medical services, call them. They're the fastest way to get to a hospital. Taking aspirin, which thins the blood, and nitroglycerin, which opens up the artery, can help keep the heart attack from getting worse. In the emergency room, doctors can diagnose a heart attack. They commonly use an electrocardiogram to measure the heart's electrical activity, and a blood test to assess heart muscle damage. The patient is then taken to a high-tech cardiac suite, where tests are done to locate the blockages. Cardiologists can reopen the blocked artery by inflating it with a balloon in a procedure called an angioplasty. Frequently, they also insert a metal or polymer stent that will hold the artery open. More extensive blockages might require coronary artery bypass surgery. Using a piece of vein or artery from another part of the body, heart surgeons can reroute blood flow around the blockage. These procedures reestablish circulation to the cardiac muscle, restoring heart function. Heart attack treatment is advancing, but prevention is vital. Genetics and lifestyle factors both affect your risk, and the good news is that you can change your lifestyle. Exercise, a healthy diet, and weight loss all lower the risk of heart attacks, whether you've had one before or not. Doctors recommend exercising a few times a week, doing both aerobic activity and strength training. A heart-healthy diet is low in sugar and saturated fats, which are both linked to heart disease. So what should you eat? Lots of fiber from vegetables, chicken and fish instead of red meat, whole grains, and nuts like walnuts and almonds all seem to be beneficial. A good diet and exercise plan can also keep your weight in a healthy range, which will lower your heart attack risk as well. And of course, medications can also help prevent heart attacks. Doctors often prescribe low-dose aspirin, for example, particularly for patients who've already had a heart attack and for those known to be at high risk. And drugs that help manage risk factors, like high blood pressure, cholesterol, and diabetes, will make heart attacks less likely too. Heart attacks may be common, but they don't have to be inevitable. A healthy diet, avoiding tobacco use, staying fit, and enjoying plenty of sleep and lots of laughter all go a long way in making sure your body's most important muscle keeps on beating.
Now that we have seen that heart disease has major health consequences, why should Arkansans specifically be so worried? When looking at mortality rates in Arkansas, the number one cause of death is heart disease. And when we look at the number 3 cause of death, it's stroke. That is particularly why this topic needs to be addressed throughout the state of Arkansas. Let's take a closer look at the situation here that's happening in our state. Here we see a U.S. map with different shades of blue indicating cardiac disease. If we look at our state, it is shaded in dark blue, which indicates that about 4.9% of Arkansas residents have been told that they have a cardiac disease. To put this in more perspective, our state is ranked the 48th state for overall heart health. Not so great. Let's take a closer look at Arkansas overall. And what we have here is the state of Arkansas divided into each of its districts. And what we're seeing is the mortality rate per district, as indicated by shades of green. So the darker shades of green are going to show that there's around 60 to 80 mortalities per county. So when we look at this map, we see that more deaths are occurring in the south and southeastern parts of Arkansas. These places are characteristic of lower socioeconomic standings and lack of access to care. And this map shows the coronary heart disease per district in Arkansas, as indicated by the color blue. The darkest shades of blue are showing that there are more cases. So as we saw in the last slide, we are also seeing more cases occurring towards the eastern part of the state, where there is a lack of access to care, especially when compared to central and northwest Arkansas. Now that we've seen a geographic breakdown, let's take a close look into a county we're all familiar with, Pulaski County. This chart shows the rates of civic heart disease per 100 people. We see in one column that we have the national average, and in the other column we have Pulaski County's average. I first want to draw your attention to the first red box on the top. When we compare the coronary heart disease in the U.S. and Pulaski County, the number of cases are pretty close. Yet when we look at hospitalization rate, Pulaski County has a much higher rate than the U.S., more than 3 points higher. This can be a result of multiple causes, such as possibly the severity of coronary heart disease is higher in Faulkner County, or that medical care in Arkansas is not as advanced as the average medical care for coronary heart disease in the U.S. Next, I want to draw your attention to the second red box. Here we are comparing the rate of disease from heart failure, hypertension, which is known as high blood pressure, which can lead to many different heart complications, and stroke in the U.S. and in Pulaski County. In each type of death, Pulaski County has a much higher rate of death when compared to the U.S. This just shows that it's necessary to address these health complications in the state of Arkansas. And more importantly, it is key to address specific health disparities that are associated with heart disease and stroke. First, let's compare the statistics of heart disease between men and women. The graph shows the comparison of cardiac disease in males and females. This graph also compares these statistics to Arkansas average to the U.S. average. Just looking briefly, we can see that men overall have a higher incidence of heart disease than women. Also, Arkansas has a higher incidence of heart disease than the U.S. average. Next, let's take a look at the age differences in heart disease. It should come to no shock that older generations experience higher rates of cardiac complications. Around 15.3% of adults 65 or older in Arkansas have had some sort of heart disease. Yet what I would like to point out on this slide is that with every age group, we see that Arkansas has a higher incidence of heart disease than the U.S. Here we have comparisons of different races in Arkansas and their incidences of heart disease. Just looking briefly, it is clear that whites have a higher incidence of heart disease. This is particularly interesting considering that these were the statistics 5 years ago. Here we can see that African American males experience the highest rate of heart disease than any other group. However, it may be kind of tricky to compare the two types of graphs. The graph we see here is controlling for gender, therefore giving a better insight into health disparities. Yet this graph we see here is around 5 to 7 years old, and this graph has the most up-to-date data. So an overall conclusion we can draw from the graph we see here is that whites and Hispanics in Arkansas experience more heart disease than the national average, and this chart only gives a partial view of disparities since gender and age are not accounted for.
Potential issues. Let's focus a little on why Arkansas may have a higher rate of cardiovascular disease and stroke. Cultural traditions. The South is famous for its Southern cuisine, especially when it comes to fried foods. Arkansans typically eat more fried foods in the Southeast demographic location. This can become a recipe for disaster later in life. The history of Arkansans and the relationship of Southern cooking was a traditional way of gathering with family to eat good home cooking. Unfortunately, many of the foods cooked then and now are not good for the mind, body, or soul. Cultural acceptance. In today's culture, e-cigarettes have become very popular. However, e-cigarettes and vaping can also lead to heart disease and stroke. Unhealthy lifestyles. Cigarette smoking, drinking alcohol, and fast food can all lead to respiratory problems, liver failure, and/or heart attack. Cultural beliefs. Some social determinants regarding culture and lifestyle can also be attributed to cardiovascular disease and stroke. Other risk factors. According to the CDC, most of the major risk factors can be managed or prevented. Incorporate physical activity. Being active is good for the heart. Incorporate at least 25 to 30 minutes of exercise in your daily routine. Do an activity that is right for you. Moderate intensity, vigorous, or high intensity. Awareness. Help bring awareness to cardiovascular disease and stroke. Heart awareness. February is National Heart Health Awareness Month, and September 29th is World Heart Day. Stroke awareness. May is American Stroke Month, and October 29th is World Stroke Day. Love you wholeheartedly. Remember, there is only one you, so take care of you and love yourself wholeheartedly.
Disparities in access to health services affect individuals and society. Limited access to health care impacts people's ability to reach their full potential, negatively affecting their quality of life. Health insurance coverage helps patients get into the healthcare system. Uninsured people are less likely to receive medical care.
So, in regards to barriers for implementations of the health disease, politics is also one of an issue that may be considered. As we've known, in January, we just had a new president elected, and the Congress and the Senate has also been turned over from Democrats to Republican, which including a change of different mindsets. So with that, there's new healthcare plans being proposed as a way to repeal and remove the Affordable Care Act. Their proposal is the American Health Care Act. This talk about eliminating individual employer mandate for penalties for those who did not have or buy their own medical insurance, and that could have created much of a high deficit, because if these people don't have insurance, who would have covered for the existing patients who's needing more health or require more health care, such as child or those with pre-existing conditions or senior citizens. And though it said there's no coverage denial for patients with pre-existing condition, but there is an increase in premium by 30% regardless of their health status. In addition, I also look into what else they could have been influencing the prevention of cardiovascular disease, and that include less funding and resource to finance preventive measures. So, for example, by phasing out expansion of Medicaid coverage, you would lose some of the fundings for the states to help build preventive programs and implementing some of the assistance to help cover these
patient population who are more at risk for having cardiovascular disease because they live with more higher risk factors. Then in regards to our economy, what may have been an issue for implementation of prevention of cardiovascular disease is maybe the recent 2008 depressions. This lead to a lot of job loss and also increase in unemployment. And eventually, due to that, people would lose money from their retirement saving and also from their stock investment. So they would rely on more unhealthy living style because of less money to help with their cash flow, since they also have to make ends meet with making mortgages payment, house payments, car payments, and bills and utilities. So they eat unhealthier, cheaper food, and that includes fast food, which is more greasy and increased risk for cholesterol. Additionally, because they had to do so to pay bills, they had to work harder to make ends meet, and thus that increased the stress and hormonal imbalance, leading to increased risk of having stroke or heart attack.
Next, let's take a look and see how heart disease and stroke is being prevented through research.
Listed are some of the purposes of the interim study. In 2010, Hypertension in Arkansas, an interim study for the Public Health, Welfare, and Labor Committees of the Arkansas Senate and House of Representatives was presented. High blood pressure is the most important risk factor for stroke.
In regards to policy and plans, you can break it up into national level and state level. At the national level, we already heard about the Healthy People 2020 in not just our class but also at other public health class. And this is a national objectives and goals where we've set to help improve health, wellness, and healthy. Not only these objectives are used for our nations, but we can also use this as our own personal behavior change to help improve our personal wellness. Secondly, there's also national guidelines that has been published or implemented regards to preventions and treatments of cardiovascular disease like heart attack, arrhythmia, acute decompensated heart failures, and these are usually supported by the American Heart Association. There's guidelines for treatment and prevention of cholesterol, which is done by the adult treatment panel, and there's guidelines for hypertension treatments and prevention, and that was put together by the joint national committees. And thirdly, there's the Affordable Care Act, which was started by President Obama. And you can see on the wheel to the right, there's many benefits that it provides, including access to health care and improving quality and lowering healthcare costs, and of which providing more preventive care measures. So we can target and prevent heart disease before it happens. In terms of state level, Arkansas has many programs, of which here a few examples include the Chronic Illness Collaborative, the Healthy Employee Lifestyle Program, the Comprehensive Plan for Reducing Burden of Heart Disease and Stroke in Arkansas, and the STAR Health Initiative. So besides the national and state level, we also have to look at the type of population that are at risk. And as we've known, obesity is a risk factor that's associated with cardiovascular disease. So Arkansas has responds to this at a much younger level, which is targeting childhood obesity. We've put together acts to implement a comprehensive program combating this situation by creating school nutrition and physical activity committees, banning vending machines in elementary school, and requiring disclosures of vending contracts, establish mandatory BMI or body mass index assessment for school-aged children, and all of these is putting together in conjunction with the Arkansas Child Health Advisory Committee assistant. Together they work to prevent and reduce risk factors in youth before the disease actually happen. So in addition to the policy and plan of the childhood obesity, there are other enforcements that's done. So in regards to the national level, the U.S. Preventive Service Task Force was charged with screening guidelines that I previously mentioned before they were published and implemented in practice. As far as what has been enforced in Arkansas, there's many legislative acts in place. So a few examples included here are the Acute Stroke Care Task Force, the Incentive for Improvement of State Employee Health, the creation of school-based automated external defibrillator to help with people who have stroke that occur at school, or actually for patient who has cardiac arrest or cardiac arrhythmias. They also implement increase in cigarettes and tobacco product tax. As we've known, tobacco and cigarettes are also a risk factor leading to poor cardiovascular disease. And additionally, they require health benefit plans provided to cover for treatment of morbid obesity. As we've known, obesity, as previously mentioned, is another risk factor.
Arkansas Stroke Assistance through Virtual Emergency Support has been operational since November 2008. The Arkansas SAVES program provides rural hospitals with a high-tech video communication system so that when stroke patients come through the emergency room, they can quickly and expeditiously receive appropriate care and a real-time consult from one of the state board certified vascular neurologists. Stroke neurologists are on call 24 hours a day.
And that is the end of our project as we have looked into cardiovascular disease and stroke here in Arkansas. Listed above is everyone who participated in the video, and before we leave, we actually have one last little clip to show you.
The Red Dress event that's launching Fashion Week in New York. The whole Red Dress campaign is all about raising awareness on heart disease.
We're very excited for the NIH and NHLBI to be part of this private-public partnership that is putting a limelight on the challenges and problems of women and heart disease, when literally we can reach millions through messaging like this and events like this. A lot of our partners are very good at marketing messages.
I am here because I am the Diet Coke ambassador, and I was just happy they asked me again.
It's okay to have fun, and you can get a positive message out there, and that's what's great about this organization, and I'm so excited and thrilled to be a part of it.
Heart disease is the #1 killer of women, and many women don't know that.
I think it's extraordinary that Heart Truth is sponsoring this event so that we can get the truth out about women's heart disease and do it in such a fun way.
It's important to mix fun with seriousness. Besides the beauty that we see around us, is a reminder that this is an important message.
I have a story to tell, and it's about paying attention to your health.
You look like you have a story. What's your story?
What's your story?
What's your story?
Sadly, my father's mother dropped dead at 66 of a heart attack, and no one even knew. We had no idea she was even sick.
My grandmother died from heart disease.
My mother passed away of complications of a stroke and heart attacks. She was an organic farmer. She hiked 5 miles a day. You would never think that she would be susceptible to heart disease.
This issue is important to me because it's personal. I'm battling heart disease and a survivor of heart disease.
My mom has high cholesterol, my dad has high cholesterol, so, you know, right there, I'm at risk for having heart problems down the road.
Awareness should be translated into action that women can take to prevent heart disease by talking to their doctors and taking control of their lifestyle, particularly by knowing the numbers.
What's my blood pressure? Where are my cholesterol numbers at? Where are my triglycerides? You can make powerful choices that will yield a really positive, strong effect in your life. Food, stress management, exercise are all the best form of preventative medicine.
I don't like the gym, but I go to race my heart.
Gymnastics was my life, and I trained 7 hours a day. So now I have to find the time to work out and make it fit in my schedule.
I think it's very important that we make health fun.
I've been doing some yoga lately, hiking,
Dancing, playing with your kids.
There's a lot of running involved.
I like to work out and I love to dance.
A lot of spin.
Zumba, whatever.
I'm not a perfect person. I don't have the perfect habits, but I try to stay healthy, try to exercise, try to eat right. My husband always talks about, you know, the 80-20 rule. 80% of the time we try to eat really good, and the other 20% of the time we eat whatever we want. So, you know, there's a balance.
As women, we're kind of hardwired to be caretakers, but not of ourselves. I think women put everybody else first. You kind of have to. You got a lot going on.
She's my personal trainer, although I had to fire her.
She's too tough.
I'm just trying to get her healthy and just so she can live a long life.
There's a grassroots component, that there's outreach and events that are happening in communities all across the country.
I'm part of Follow the 50, which is a group that comes from northeastern Connecticut, and they took 50 volunteers to be heart healthy for a year.
Go, Cindy.
In the beginning, only 20 or 30% of women recognized that heart disease was the #1 killer in women. And as a result of the Heart Truth campaign, those awareness statistics have changed for the better, and now it's over 50%. And we need to continue to enhance that awareness and trigger that awareness into action such that we reduce cardiac deaths among women.
You look like you have a story.
What's your story?
What's your story?
What's your story?
What's your story?